something we haven't really talked about too much on the show before is the value of vitamin D, because this is something that you don't need a doctor for, frankly, right?
Correct.
And from what I understand, it's pretty significant. Having a decent level of vitamin D puts you in a lot stronger position relative to the virus, as I understand it. Maybe you can expound on this a bit, because you mentioned it earlier.
Yeah, I did mention that in that talk that I gave. I had mentioned, look, we don't just have that vitamin D deficiency. It's at pandemic levels. We have an indoor lifestyle now, and it's shocking. As I see those patterns in the lab, I realize how many people have a low vitamin D, and too many doctors actually don't check that on their patients. So vitamin D isn't a vitamin per se. It's a prohormone that our body will make in the spring and summer months when we get our sunshine. And in the fall and the winter, this is where I got controversial as well. I said, look, there's really no such thing as flu and cold season. There's just low vitamin D season. And it's a little hyperbolic, but even a study by Dr. Martineau that came out a couple of years ago said, look, if your vitamin D levels are normal, your propensity to get the flu or cold is cut by half. And then if you do get one, your symptoms and severity are cut by half as well. So it's out there in the medical literature, and normal vitamin D levels decrease cancer risks in about 17 different cancers, decrease death from coronary disease, decrease problems with osteoporosis, decrease viral infections, decrease clotting disorders. So many things that vitamin D does because it's an essential part of our pathophysiology. So I spoke out about this and I said, look, if we can get our vitamin D levels up, our chances of being severe with COVID are far less. Well, large study by Dr. Kaufman in 2020 looked back at 191,000 patients and said, hey, look, if your vitamin D level is above 50 or not, or above 50, your chance of getting COVID goes down by about half and your severity goes down by 80+%. And Mayo Clinic did a study and said, if your vitamin D is above 30, your chance of being in the ICU was cut by a huge percentage. And then if it was below 30 and below 20, then that was your high percentage chance of getting intubated. So we had signals early on. Vitamin D is like the conductor of a fine symphony, and it tells your body, this section come in, that section tune out, this section come in at mezzo forte and at forte and go down to piano. So vitamin D is that conductor of our immune system. Now you've heard about the cytokine storm from which people have passed. If your vitamin D is insufficient, your immune system is more like the mosh pit at a punk rock concert. Ping, 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 crashing together and not having that signal to turn on or turn off. So vitamin D is this fantastic conductor of orderliness in our immune responses. And every nucleus on every cell in your body has a receptor for vitamin D. So as a pathologist and as one who studies patterns, I tried to share this message of how important this is for our overall immune health.